PIQRAY alpelisib tablets is indicated in combination with fulvestrant for the treatment of postmenopausal women and men with hormone receptor HR-positive, human epidermal growth factor receptor 2, HER2 negative, PIK3CA mutated, advanced, or metastatic breast cancer as detected by an FDA-approved test following progression on or after an endocrine-based regimen. In hormone receptor positive, HER2 negative, advanced breast cancer, PIQRAY is the first and only therapy specifically for patients with a PIK3CA mutation. Highlights of important safety information. PIQRAY alpelisib tablets is contraindicated in patients with severe hypersensitivity to it or any of its components. Serious adverse reactions include severe hypersensitivity, severe cutaneous adverse reactions, hyperglycemia, pneumonitis, diarrhea, and embryo-fetal toxicity. Most common adverse reactions, including laboratory abnormalities, all grades, incidence greater than or equal to 20%, were glucose increased, creatinine increased, diarrhea, rash, lymphocyte count decreased, gamma-glutamyl transferase increased, nausea, alanine aminotransferase increased, fatigue, hemoglobin decreased, lipase increased, decreased appetite, stomatitis, vomiting, weight decreased, calcium decreased, glucose decreased, activated partial thromboplastin time prolonged, and alopecia. Please see additional important safety information at the end of this video. Please see full prescribing information for PIQRAY by visiting PIQRAY.com. To better understand PIK3CA mutations, let's take a look at the pathway signaling effects and tumorogenic implications of this common genetic alteration. PIK3CA is the most commonly mutated gene in HR-positive, HER2-negative advanced breast cancer, and patients with the PIK3CA mutation face a worse prognosis. In fact, approximately 40% of these HR-positive, HER2-negative advanced breast cancer patients harbor a mutation in this gene. PIK3CA mutations may lead to hyperactivation of PI3K alpha, a key upstream component of the PI3K pathway. PI3K alpha hyperactivation affects multiple signaling cascades in the PI3K pathway, including both AKT-dependent and AKT-independent cascades. Each of these signaling cascades that stem from PI3K has distinct effects. Hyperactive PI3K alpha signaling due to PIK3CA mutation may also contribute to resistance to common endocrine-based therapies used in HR-positive, HER2-negative advanced breast cancer. PIQRAY, or alpelisib, is a potent and selective inhibitor of PI3K alpha. PIQRAY inhibits the alpha isoform of PI3K 50 times more potently than other PI3K isoforms, beta, gamma, and delta. In breast cancer cell lines, alpelisib inhibited the phosphorylation of PI3K downstream targets, including AKT, and showed activity in cell lines harboring a PIK3CA mutation. This means it interrupts multiple hyperactive downstream signaling cascades. In vivo, alpelisib inhibited the PI3K AKT signaling pathway and reduced tumor growth in xenograft models, including models of breast cancer. Targeting PIK3CA mutations may overcome resistance to endocrine-based therapies used in HR-positive, HER2-negative advanced breast cancer. PI3K inhibition by alpelisib treatment has been shown to induce an increase in estrogen receptor transcription in breast cancer cells. PIQRAY is used in combination with fulvestrant, a selective estrogen receptor degrader, or SERD. PIQRAY and fulvestrant work synergistically to inhibit two major cancer pathways, the PI3K pathway and the estrogen receptor pathway, making this combination of therapies a treatment option in HR-positive, HER2-negative advanced breast cancer with a PIK3CA mutation. Test your appropriate patients for PIK3CA mutations and choose PIQRAY, the first and only therapy specifically for advanced breast cancer patients with a PIK3CA mutation. Important safety information. PIQRAY is contraindicated in patients with severe hypersensitivity to it or any of its components. Severe hypersensitivity. Severe hypersensitivity reactions, including anaphylaxis and anaphylactic shock, can occur in patients treated with PIQRAY. Severe hypersensitivity reactions were manifested by symptoms including, but not limited to, dyspnea, flushing, rash, fever, or tachycardia. The incidence of grade 3 and 4 hypersensitivity reactions was 0.7%. Advise patients of the signs and symptoms of severe hypersensitivity reactions. Permanently discontinue PIQRAY in the event of severe hypersensitivity. Severe cutaneous adverse reactions, SCARS. SCARS, including Stevens-Johnson syndrome, SJS, erythema multiforme, EM, toxic epidermal necrolysis, TEN, and drug reaction with eosinophilia and systemic symptoms, DRESS, can occur in patients treated with PIQRAY. In the SOLAR-1 study, SJS and EM were reported in 0.4% and 1.1% of patients, respectively. DRESS was reported in patients in the post-marketing setting. If signs or symptoms of SCARS occur, interrupt PIQRAY until the etiology of the reaction has been determined. Consultation with a dermatologist is recommended. If a SCAR is confirmed, permanently discontinue PIQRAY. Do not reintroduce PIQRAY in patients who have experienced previous SCARS during PIQRAY treatment. If it is not confirmed, PIQRAY may require dose modifications, topical corticosteroids, or oral antihistamine treatment. Advise patients of the signs and symptoms of SCARS. For example, a prodrome of fever, flu-like symptoms, mucosal lesions, progressive skin rash, or lymphadenopathy. Hyperglycemia. Severe hyperglycemia, including ketoacidosis, can occur in patients treated with PIQRAY. Hyperglycemia was reported in 65% of patients treated with PIQRAY. Grade 3, FPG greater than 250 to 500 mg per deciliter, and Grade 4, FPG greater than 500 mg per deciliter, hyperglycemia were reported in 33% and 3.9% of patients, respectively. Ketoacidosis was reported in 0.7% of patients, N of 2, treated with PIQRAY. Before initiating treatment with PIQRAY, test fasting plasma glucose, FPG, HbA1c, and optimize blood glucose. After initiating treatment with PIQRAY, monitor fasting glucose, FPG, or fasting blood glucose, at least once every week for the first 2 weeks, then at least once every 4 weeks and as clinically indicated. Monitor HbA1c every 3 months and as clinically indicated. If a patient experiences hyperglycemia after initiating treatment with PIQRAY, monitor fasting glucose as clinically indicated and at least twice weekly until fasting glucose decreases to normal levels. During treatment with anti-diabetic medication, continue monitoring fasting glucose at least once a week for 8 weeks, followed by once every 2 weeks and as clinically indicated. Consider consultation with a healthcare practitioner with expertise in the treatment of hyperglycemia and counsel patients on lifestyle changes. The safety of PIQRAY in patients with type 1 and uncontrolled type 2 diabetes has not been established, as these patients were excluded from the SOLAR-1 trial. Patients with a medical history of type 2 diabetes were included. Patients with a history of diabetes mellitus may require intensified diabetic treatment. Closely monitor patients with diabetes. Based on the severity of the hyperglycemia, PIQRAY may require dose interruption, reduction, or discontinuation. Advise patients on the signs and symptoms of hyperglycemia. For example, excessive thirst, urinating more often than usual or higher amount of urine than usual, or increased appetite with weight loss. Pneumonitis. Severe pneumonitis, including acute interstitial pneumonitis and interstitial lung disease, can occur in patients treated with PIQRAY. Pneumonitis was reported in 1.8% of patients treated with PIQRAY. In patients who have new or worsening respiratory symptoms or are suspected to have developed pneumonitis, interrupt PIQRAY immediately and evaluate the patient for pneumonitis. Consider a diagnosis of non-infectious pneumonitis in patients presenting with nonspecific respiratory signs and symptoms such as hypoxia, cough, dyspnea, or interstitial infiltrates, on radiologic exams and in whom infectious neoplastic and other causes have been excluded by means of appropriate investigations. Permanently discontinue PIQRAY in all patients with confirmed pneumonitis. Advise patients to immediately report new or worsening respiratory symptoms. Diarrhea. Severe diarrhea, including dehydration and acute kidney injury, can occur in patients treated with PIQRAY. Most patients, 58%, experience diarrhea during treatment with PIQRAY. Grade 3 diarrhea occurred in 7% N of 19 of patients. Based on the severity of the diarrhea, PIQRAY may require dose interruption, reduction, or discontinuation. Advise patients to start antidiarrheal treatment, increase oral fluids, and notify their healthcare provider if diarrhea occurs while taking PIQRAY. Embryo-fetal toxicity. Based on findings in animals and its mechanism of action, PIQRAY can cause fetal harm when administered to a pregnant woman. Advise pregnant women and females of reproductive potential of the potential risk to a fetus. Advise females of reproductive potential to use effective contraception during treatment with PIQRAY and for 1 week after the last dose. Advise male patients with female partners of reproductive potential to use condoms and effective contraception during treatment with PIQRAY and for 1 week after the last dose. Refer to the full prescribing information of fulvestrant for pregnancy and contraception information. The most common adverse reactions, all grades, incidence greater than or equal to 20%, were diarrhea, 58%, rash, 52%, nausea, 45%, fatigue, 42%, decreased appetite, 36%, stomatitis, 30%, vomiting, 27%, weight decreased, 27%, and alopecia, 20%. The most common grade 3 of 4 adverse reactions, incidence greater than or equal to 2%, were rash, 20%, diarrhea, 7%, fatigue, 5%, weight decreased, 3.9%, nausea, 2.5%, stomatitis, 2.5%, and mucosal inflammation, 2.1%. The most common laboratory abnormalities, all grades, incidence greater than or equal to 20%, were glucose increased 79%, creatinine increased 67%, lymphocyte count decreased 52%, gamma-glutamyl-transferase (GGT) increased 52%, alanine aminotransferase (ALT) increased 44%, hemoglobin decreased 42%, lipase increased 42%, calcium decreased 27%, glucose decreased 26%, and activated partial thromboplastin time (APTT) prolonged 21%. The most common grade 3-4 laboratory abnormalities, incidence greater than or equal to 5%, were glucose increased 39%, GGT increased 11%, lymphocyte count decreased 8%, lipase increased 7%, and potassium decreased 6%. Indication: PIQRAY, alpelisib tablets, is indicated in combination with fulvestrant for the treatment of postmenopausal women and men with hormone receptor HR-positive human epidermal growth factor receptor 2, HER2 negative, PIK3CA mutated advanced or metastatic breast cancer as detected by an FDA-approved test following progression on or after an endocrine-based regimen.